we've got Stephanie calling with a chronic and persistent rash that our good friends, actually they're not our good friends, they're not my good friends, the MDs have been unable to treat. Stephanie, are you here?
Yes, I am.
All right, so bring me up to speed.
Well, February is when it first happened. Went in for antibiotics and prednisone. They called it idiopathic because they couldn't decide whether it was inflammatory, bacterial, or allergic. When it went away, and then last week it come back with a vengeance. Looks like a really bad sunburn, very inflamed, can be very hard at times. It oozes and weeps, and then it crusts over, and now it's starting to spread again. And it's very tender to the touch. It's like it's got almost like acne-like pimples that start to pop up, and then that's where it spreads to.
Okay. Now, how long has this been going on, Steph?
This round since, well, it's been a week now again.
Well, what about the first time in your life you ever got this?
Probably 2.5 years ago when it showed up on my arm.
And was it on the same side of your body or a different side?
No, it's all been on the left side of my body.
Okay. And when it first showed up, was it as bad as it is now? Was it worse, or was it, It was just about as bad. It was very pinprickly, hot, very sensitive. And you've never had it before, right?
Never. I was when I first went in for it 2.5 years ago, I was told it was eczema.
Yeah. Okay. Well, when it first showed up 2.5 years ago, was there anything new in your life? Like you just started exercising, or you just lost a bunch of weight, or you just moved to a new town, or you got a new dog, or got divorced, or anything new in your life?
No, other than I blamed it on stress up until that point.
What do you mean stress?
It's just from the job. I'm a portrait photographer, and having to deal with the ins and outs of all part of the job.
Yeah. Okay. All right. So, and you haven't started to exercise. You didn't start a new exercise program a couple of years ago, right?
No.
Hot yoga.
No.
Or,
you know what? I did. I went on this thing called Slimgenics.
And are you still on Slimgenics?
No, I quit after 4 months because I couldn't afford the product they were trying to push me to take.
And Slimgenics involved what? A lot of aerobic workout?
No, it's just basically taking a lot of food out of your diet and then taking their supplements.
Yeah, okay. So it wasn't an increased exercise regime, right?
No.
Okay. All right. Well, there's when we see peculiar stuff in medicine that has a strong presentation, and, we do lab work, we do diagnostic stuff, and nothing is showing up, right? Nothing is showing up. Mm-hmm. When we see that type of an occurrence, what we do in the holistic community is fall back on the belief, it's actually more than a belief, we fall back on the knowledge that the human body has the ability to fix itself. And so what are we going to do? Rather than try to micromanage the biochemistry of your body, or actually try to pinpoint 100% with a diagnostic, dead-on diagnostic, code, tell you what this is, what we do is we support and promote the health of the skin and, in this case, your immune system. Now, so here's what I would do for this. Are you on the gluten-free diet?
I'm getting there, yes.
So that's a no, right?
Up until a week ago, it was completely no. Up until a week ago when this all started happening
you can't, it's like being pregnant. You can't be a little pregnant, right? Oh, yeah, well, I'm just a little pregnant, doctor. Yeah.
No, it's been a week since I've been totally gluten-free.
All right, good girl. So that's important because very frequently when we see chronic, persistent skin stuff, especially if it, shows up and goes away, shows up and goes away, shows up and goes away like that, it can be related to oxidative damage to the 7 dermal layers of the skin caused by consistent consumption of all the wrong food and compounded by lack of nutrition that the body has to keep that part of your skin healthy, kind of like picking a scab, it's just never going to heal. So the main foods to consider eliminating 100%, because we would consider them like prime suspects in our investigation here, would be the gluten-containing foods, wheat, barley, rye, and oats.
Okay.
So you really need to dial that in 100%. I mean, I don't even want you to look at wheat, barley, rye, or oats, all right? Okay. I don't even have a crouton, not even one single molecule of wheat, barley, rye, or oats. And it's not that hard to do, actually. And it's kind of fun when you get into it because I don't know. I don't want to go off on a riff about that, but dial in the Good Food, Bad Food Diet, please. You can download that for free from fireyourmdnow.com. Now, the other thing that we want to do in this case is give your body nutritional support for the skin, because the skin's affected here, right? Mm-hmm. Kind of a no-brainer. So the nutritional support that we provide to the skin, interestingly, is the same stuff that we provide to the joints and ligaments, because they're made out of the same stuff. But you need to start getting the sulfur-bearing molecules that are in that glucosamine sulfate into the body. And the last thing that I would do in this regard would be selenium. Selenium is really increases the uptake of sulfur in the skin and in the tissues that need it. It's kind of like a turbocharge for the car, right? So whenever we're trying to support and promote anything having to do with sulfur-bearing molecules on the skin or in the joints, when we add selenium into the mix, it really speeds things up quite a bit. And for the icing on the cake, get the colloidal silver. It's colloidal silver. It's a little liquid. And I think a 16-ounce bottle, an 8 or 16-ounce bottle, and you want to get a little, go to CVS and get a little tiny spray bottle, right, a little tiny spray bottle. Mm-hmm. Dump the colloidal silver into the spray bottle, and when you get that weepy eruption, I want you to spray the colloidal silver onto it 4, 5, 6 times a day. If there is a viral component, which there may be, because when you get a weepy, sticky, burny eruption like this, it's bells and whistles in my diagnostic brain go off about viral, and viral stuff is kind of tricky because it can be a garbage can diagnosis. You know, a doctor doesn't know what the heck to call it, so they call it idiopathic, right? Yeah, well, thanks, doc. That's $600 I just gave you, and you tell me you don't know what the hell it is, but rather than being honest saying you don't know what the hell it is, you're telling me it's idiopathic. And what idiopathic means is the guy that made the diagnosis was an idiot. That's the best way to think about that. So spray the colloidal silver on it 4 or 5 times a day. See if that doesn't knock down the time that this sticks around. Clean your diet up. Take those nutritional supplements. Or believe it or not, inside of this domain, the single most important thing for you to do is be gluten-free. Now, you know, you need the nutrients too. But really, there's a double whammy possibility here that not only is the wheat, barley, rye, and oats impairing the absorption of nutrients into your body, but could also be producing a pro-inflammatory effect. So you need to knock that off yesterday.